I'm Rey Martorell. I'm a professor of nutrition at the Department of Global Health at Emory University. I have worked in nutrition for about 35 years. Anemia is a very low concentration of red blood cells, and its causes are many. About half of anemia worldwide is caused by iron deficiency. In some countries, genetic abnormalities like sickle cell are causes of anemia, but again, about half of all anemia is due to iron deficiency. Anemia is a very important problem in public health. It has many consequences, and a key consequence is the result of the shortage of red blood cells. And red blood cells deliver oxygen to all organs and tissues. And so if you have anemia, it means you're not getting enough oxygen, which means you feel tired, you feel lethargic, your capacity to do work is also impaired. And another consequence is that anemia can cause impairment of child development and learning. So this is an important issue that has long-term consequences for individuals and societies. It increases the risk of mortality in women at childbirth, and this is due to an interaction between anemia and hemorrhaging. A normal woman might tolerate some bleeding, but if the woman is anemic, particularly severely anemic, any amount of bleeding will cause death. Costa Rica is a small country in Central America. It's really a pioneer in food fortification. It's been fortifying, for example, wheat flour for quite a long time. It currently fortifies a basket of foods, a variety of foods including sugar, salt, flours, wheat and corn. Together with colleagues from Costa Rica, we conducted an evaluation of the food fortification program in Costa Rica. Several years ago, Costa Rica improved the quality of the iron that was being added to wheat flour and to corn flour and to milk, and began using compounds that were well absorbed. And we looked at a national survey, and we were able to compare the prevalence of anemia in both women and children before and after these changes were made, and found there was a remarkable reduction. In women, anemia was reduced from 18 to 10%, and in children from 19 to 4%. So there was evidence of a strong impact due to the fortification program of Costa Rica. There are important lessons that Costa Rica provides for other countries. In some countries, the compounds that are being used to fortify foods with iron are not very good compounds, and they may want to take a look at the program in Costa Rica and think about what they might do to improve that aspect. They also need to look at dietary surveys to see if the foods that are being fortified are being consumed by the population that is a priority population in order to reduce anemia. And they can also look at the monitoring system that Costa Rica has, and also at the design of the evaluation that Costa Rica used. I think if countries do this, they will improve the impact of their programs.